And we are live. Good evening po and welcome to CDC Ph Livestream. Hello, Doc Francis. Doc Quack Francis.
Ako po si Dr. Lab. Dr. Lab po ang aking handle.
Good evening po, Doc Homer Lim.
Hi, good evening everyone.
And good evening, Doc Iggy.
Hi, good evening.
Kamusta naman po kayong lahat?
Ayan, exciting ng gabi to.
Good to see you.
Okay.
Okay, mute muna natin music natin. Okay, we finally made it. Sorry for the slight delay there. Technical issues. Ano ba topic natin, Doc Quack Francis?
Marami tayong topic. Grabe itong linggong ito. Ang daming kung ano-anong lumalabas na balita. Balitang hindi ka nais-nais. Balitang mali. Mali ang mga pinagsasabi.
Fake news.
Diba?
Huwag mo sabihin may fake news tayo.
Merong fake news tungkol sa COVID. At grabe.
Ano ba?
Saan tayo mag-umpisa?
Ewan ko sa inyo, pero ako nasa winter ako ha. Medyo malamig dito ngayon. Okay, saan tayo mag-umpisa? Umpisa muna natin sa Okta muna tayo. Kasi may guidance ang Oktang binigay na baka daw in January papalo ng 500,000 cases na infection ng Pilipinas. So, nakakatakot no? Oo, nakakatakot. Wow, 500,000 cases. Doc, hindi ba kayo natatakot na 500,000? Papalo na ng 500,000 cases sa Pilipinas?
Ano, Doc?
Hindi. Sige. Homer, mauna ka.
Go ahead.
Nagkahiyaan pa yung dalawang doktor natin.
UP yun, UP. Kailangan UP ang magsalita kasi UST ako magalit sa akin eh.
UP na, Pisay pa.
Hindi, chinek ko ha. Chinek ko, Homer, may mga UST ha.
Okay.
Ano lang yun, parang advisory. Hindi naman sila main eh. Ang main talaga is UP.
Okay. Teka, bagong lahat. Sino ba, Doc, ang Okta?
Yeah, I think that's what we have to clear out. What is Okta really?
Well, apparently, sila.
Yeah.
Statisticians mostly, mathematicians. I could not find epidemiologists among them. So, but yes, they are very bright mathematicians and statisticians.
Pero
that's what I know.
Di ba si Dr. Martin Kulldorff is also a statistician?
Yes. But he's also a epidemiologist.
Okay.
As well.
So among the Okta, you don't know of any epidemiologists. Of course, they can comment and correct us kung meron nga sila mga epidemiologists on staff, no? Okay, so they are in what capacity are they advising government? To your knowledge?
That apparently they're not really advising them. They've been going out on public about their information. But nagre-respond sa kanila ang government. Sometimes their information is being used, sometimes it's not. So I don't think hindi official ang relationship nila eh.
Okay, pero nakakatakot po kasi sa public yun na sabihin na 500,000 cases and that is why they're calling for the more stringent restrictions come January because kapag pumalo ng 500,000 cases, we're being joined right now by Sir Nonoy Oplas. Bienvenido Oplas is joining us. Good evening. Teka, out muna ako. Paano ako mag-out dito? Francis, sandali lang ha. Pasok muna natin si Sir Nonoy para bumati. Ayan. Pasok ka na ba, Sir Nonoy? There you are. Good evening, sir. Good to have
good evening.
Welcome to the discussion.
Good evening.
Hi, good evening, sir.
Just lang ako.
Sir.
Okay, sige. Okay, pwede ko na ibalik si ano. Paano ko ibabalik si Ayan? Okay, nawala naman si ano. Ayun, puto si Francis. Okay. All right. Okay, where were we? We were asking the question
about the Okta research when we reach 500,000.
Andito ba sa atin si Doc Iggy? Andiyan pa ba?
Yeah, I can hear you.
Sorry, sir, naputol kita.
Okay.
Yan na. It's coming na.
Ayan. Hindi, sa akin, Mari.
Yo.
Mari, ganito ang nangyari kasi sa Okta. Ang sa tingin ko, syempre, pag sinabi mong aabot ng 500,000 cases, cumulative yan. Di ba? Alam naman bumaba. So, cumulative yan.
Okay.
Pero ang dami ng sa kasong yan ay wala na, nagamot na. I mean, tapos na. Umuwi na sa kanilang bahay. So, bakit ba natin kailangan yung numero na yan? Para
Bakit
saan?
nga ba? Of course, hindi naman pwedeng weekly ang palit ng numero. Let's say, may recovery kasi, may mga deaths kasi, unfortunately. So, what's the best way ba to? Kasi, tama si Francis na kapag tinignan mo ng cumulative yan, nakakatakot nga yung numero, 500,000.
Dami yan eh. Ano, Doc Iggy, anong tingin mo?
Yeah, so presently, how many but ang cumulative at present? Is it 400,000?
Yeah, 486,000.
Yeah.
Nananakot sila na abot ng 500.
So they're saying that there will be an additional 14,000. Diba? Tama ba ako?
Something like that.
So actually, I think they're also being quoted. So when they we will reach 500,000, they actually were saying that we will have an additional 14,000. Diba? Kasi cumulative. That's the problem with mentioning cumulative. We are going to reach 500,000, but what it actually means is that we will have an additional 14,000 in the next few weeks, which is quite possible. It's a very plausible.
Yung cumulative, I make that comparison. Like for instance, the cumulative death from COVID is reported about 8,700 something, right? And the first day of death was March 11, first Pinoy death. So if we're going to count it from March 11 up to say December 16, something like 276 days. That's equivalent to 32 deaths per day. Okay? So, wag mong pagbinila, that's 32 deaths per day, COVID death. If you're going to compare that to total deaths per day on average, in 2018, it was 1,680 per day. Okay? And in 2019, is deaths per day, total. It's about 500,000 deaths in 1 year divided by 365. So in 2019, it's about 1,717 deaths per day. So kung titingnan mo yung it's not really that worrying, but what they do is use the cumulative. But if you do it in a comparative, so apples to apples, there's practically nothing to worry. So the purpose of having cumulative so-called analysis is actually, the purpose is just to cause alarm and not really to provide context to the problem.
Okay, let's take a look at the screen again. Here's the actual quote from...
It's a clickbait. It's a clickbait or to get your attention screen.
Ito sa screen,
as you said. Diba? As you said, for 486,000. So you only need 14,000 to reach 500,000. So it's a clickbait or parang ano lang yan eh. Ginamit lang nila yung 500,000. If you did not know that you're ready for 486, what's sa number na?
What's the point nga? Ang tanong ko, Doc Iggy, what's the point of even saying that you were going to reach 500,000? Is there a benchmark? Is there a ano ngayon?
Yes. The media actually put that number. I don't think they mentioned it precisely as like that. But media put that number because it's a shocking number to announce. So,
kaya nga, pati yung mukha nung nag-announce, napaka-shocking eh. Pakita mo nga ulit, Mari. Grabe. Hindi. Totoo naman eh.
It's a scary figure with scary message.
Okay, for those who cannot see it, nakalagay Okta Research Group, kaso ng COVID-19 sa bansa, posibleng umabot ng 500,000 sa pagtatapos ng taon.
Tapos ng taon. O para saan nga yan?
So in 18,000, 1,000 cases a day, easy.
Okay, so there's no point in or there's no use for that number or even mentioning that number. What's the use except to scare us all, hindi ba?
Yeah, that's the purpose. The purpose is scared. Be scared of my looks and be scared of my message.
Yung
Baka
reproductive
naman bad
number.
lighting lang yan. Di ba?
Maganda pag-usapan yung reproductive number.
Okay, ano yun?
Oh, wait, okay.
I think
The RO. R not ba yan? R not.
Are not, I think
Are
they
not,
mentioned
are
a
not,
certain number. Could you
1.1
have the link
or
there?
1.6? Ano ba?
Yun ang sabi nila,
1.06 to 1.1. They were saying those
Okay.
numbers, either 1.0 to 1.
Ang tawag ko dyan, tawag dyan, they're trying to make things complex so that people don't really understand what.
Understand. Okay.
How many of you
What?
understand are not? How many of you understand
Okay,
are
I
not?
understand
Not
are
me.
not.
Not
Si
me.
Dr. Love understands are not. ang ibig sabihin
Diba
ng
kaya-
are not is ganito. Pag above 1 ang are not, ang ibig sabihin ang disease ay dumadami. Pwedeng kumalat. Pero pag below 1, hindi pwedeng magkaroon ng epidemic or pandemic kasi hindi pwedeng kumalat yung disease ng ganon. Tama ba, Doc?
Correct.
O mali si
Correct.
Dr.
But,
Love?
Galing ni Dr. Love.
I'll give you an example. Do you know the R naught of measles?
Okay, ano yun, Doc? Ano yun?
Ano?
The R naught of is 12.
Is 12.
Is what? 12?
12.
And what is the R naught of
Okay.
COVID?
Do you know the R naught of influenza?
No.
What's the
It's
R naught
2.
of influenza?
2.
2.
Oh, mas mababa ito.
Kaya nga. So if you just mention a number, say it's alarming. The R naught number is 1.1, and it's still an epidemic. So apparently you're scaring people because if you tell them the actual numbers of the other diseases, syempre parang, hindi mo pala ganun kasama 1.1. But it is an epidemic. Like a flu, annually, it's an epidemic. Like flu. Annually, ganun naman na yung flu.
Okay. Okay.
Diba?
So,
Tama
but
ba, Homer?
Bok,
Tama, diba?
ang rason na gagamitin nila, nila ay iba naman ng measles, iba naman ng flu. Ito, mas delikado na kapatay ito ng tao.
Ayun,
Yun
good
ang
point.
mga sinasabi nila.
Ano sagot doon?
Nakakamatay yung measles, nakakamatay yung flu.
Yeah.
Both of them are-
May nabasa nga ako.
Nakamatay din ang influenza, no? Oo.
May nabasa nga akong article, ang title niya, Has COVID Murdered the Flu? Kasi bumagsak yung cases ng flu dahil yung flu cases kinount nila as COVID. Kaya na-exaggerate
that's
yung
right.
COVID, bumagsak yung cases ng flu.
Yeah. I think that's one
Totoo
of the
ba yun?
things that, yeah, it's true. It's true. So, in fact, Martin Koldroff said the same thing. How can COVID suddenly replace the flu, which has been happening every year for the last how many years? So, how come now konti ang flu compared to COVID? So, some things must be wrong. So,
Sino ba yan si Martin Koldorf? Mari, hindi kilala ng audience natin.
He's a member of the Pandata group. No? If I'm not
Yes.
mistaken, si
Of
Doc
which?
Iggy is more familiar with this.
Yeah, he's a Harvard professor right now.
and he's also a Nobel Prize winner, no? He's also a Nobel
Talaga?
Prize. So, yes.
Wow.
So,
Nobel
Yeah. So
laureate
he is.
pala ito.
yeah.
So hindi
he
small
is,
time,
but-
hindi small
Pero hindi
time
siya
si
medicine.
Martin Koldroff.
In mathematics.
Mathematics. Oh, yun.
Maski na. Alam mo, Mari, ang CDC Ph, sabihin na natin sa audience natin, ang CDC-PH, Concerned Doctors and Citizens of the Philippines, ay nakikipag-ugnayan po sa pandata.org or Panda. Tignan nyo ho sa
Pandata.
inyong mga Pandata. Tignan nyo ho sa mga browsers ninyo at magaling itong grupo ito. So, Martin Kulldorff has been formally invited by our group to speak in a forum dito sa Pilipinas or to be interviewed, and titignan nila yung mga datos natin at bibigyan nila tayo ng advice kung paano harapin itong COVID problem natin. Basically, siguro pwede nating talakayin later on. Pero itong mainit na balita muna tungkol sa anong tawag dito, grupo ng UP, yung OCTA, na medyo nananakot lang.
Huwag yun na banggitin ng UP.
Commercial lang.
Huwag yun na banggitin ng UP.
Sige, UP kasi. Ano, Doc Iggy?
Wag mo
Wag
daw
yun ang
banggitin ng
banggitin ng
UP.
UP.
Ito bang Okta?
Bakit mo naman dinadamay
Huwag
buong UP?
babanggitin. Bakit? Bakit?
Kami nga ni Doc Ige,
parang
taga-UP,
buong
parang
UP.
nakakahiya na makinggan.
Ayun,
Kanya-kanya.
si ano,
Si
Sir
Marcos
Oplas.
UP.
Sir
Si
Oplas,
Marcos
tiga
UP.
UP yan. Si
Iba-iba.
tiga UP yan.
Okay, so PANDATA stands for pandemic data, di ba? So,
Correct.
I guess we can say that
So
Okta
I
is
was
doing the
wrong.
same thing, di ba?
Yeah, so I was wrong. He had a Nobel Prize for chemistry, not
Chemistry,
mathematics.
okay.
Chemistry.
Si Levitt
Hindi ba
yun.
si ano yan? Hindi ba si
Si
Levitt yun?
Levitt yun.
Doc,
Michael
Levitt yun.
what can we expect from a study by PANDATA of the statistics that we have so far for the Philippines?
Yeah, we had them analyze the data, and it's actually already on their website, pandata.org. If you go there, there's a live parang feeds, and you will see a graph there of the Philippines. Just choose your country, Philippines, and they will show you the number of deaths and cases. Makikita niyo doon sa kanilang graphs. And very interesting is there's a graph of cases per day, and there's a line showing the what they call this, the strength of the quarantine being used. So kung makikita niyo doon, initially siyempre yung ating quarantine strength was very high, and then it was gradually reduced to, di ba, GCQ, ECQ, tapos MECQ, and then there was a tinaas ulit noong August. But if you look at the cases, it did not correlate at all with the strength of the quarantines used. Walang correlation. Kasi ini-expect mo, pag tumaas yung quarantine strength, it should lower the number of cases. So it did not show that at all. And it's the same practically in every country. You go check there. It's a well documented evidence of many countries practically.
So actually, there's so many studies na showing that that the lockdowns really didn't have an effect on the mortality, no. So I think yun nga, there was one paper highlighting that the high number of deaths in COVID is due to obesity and higher GDP. So apparently, if you're a rich country and you're fat, you're more likely to die of COVID.
Kasi malusog lahat na ng mahal at sinful na pagkain kaya mong bilhin.
In fact, the other factors are yung high median age of the population. So, so pag mas matanda yung population,
Okay.
so that is one of the major factors as well. So kung matatanda, siyempre, mas maraming namamatay.
So ang problema natin
Ako,
dito
Mari,
is kung paano i-apply yung datang binibigay sa atin ng PANDATA sa Pilipinas. In the context of the Philippine government, how do they use that? How should they use the data to move forward?
Well, that's a good question.
Funny moving
First of
forward
all,
because
way ahead na yun kasi ayaw nga, di pa nga tinitignan eh.
So tingin ko, ewan ko kung makikinig pa sila, ang gobyerno sa PANDATA, si Liachon na, nag-aaway na nga yung gobyerno at saka si Liachon. Ayaw nilang...
If you look at the way government uses data, if it's a scary data, government and media will cover it. Yeah, they will use it.
They will use it. Definitely.
If it's good news, they will not.
Okay.
They will not use it because the fear of people becoming lax with their protocols.
Tama yan. Doc Iggy at Doc Homer, ang Nonoy at Marino, ang tingin ko yung data nga, tama yung sinabi nila. Pag scary yung data, gagamitin ng gobyerno para siguro, I don't know why, kung bakit kailangan takutin ng mga tao. Yung nirelease na data ng Okta, 500,000. We are going to reach 500,000. Why should it not be scary? Bakit tayo hindi dapat matakot dyan?
Well,
number one, it's case counting.
Yeah.
Okay.
I mean, we just have
What's
to
wrong with case
consider how
counting?
many. Well, of course, it's gonna go up every time, Wala na, hindi naman uurong, hindi yung aatras. It still keep on going up. I mean, you can reach 500,000 January 1, January 5, January 30. So, I mean, it will increase whatever you do. So, I mean, even if you do the vaccines, tataas pa rin naman yan. We'll probably reach 1 million siguro before the end of the next year if, you know, if things don't go right. So, I mean, it's not the number that we should be looking at. It's the number of, as we have been saying, no, it's the number of people in the hospitals, the number of people in the ICU, and the number of people who have died from COVID, rather than looking at just the total number of cases. I think that's the most important thing
Let's
that
stay
we
on
have
that
to
point for a
consider.
little longer. No? Kasi yun na nga ang pinoproblema ko. We're watching the number. Sabi nga ni Doc Iggy, we're watching case counting. So yung figure na yan, pag pumalo ng 500,000, that's 500,000 starting in what? April or March, no? So bakit nga
March.
hindi pwedeng March? Oh, so bakit hindi pwedeng bumaba uli sa more rational figure? Kaya existing cases. Kasi yung 400,000 plus, 480,000 ba? Or no, 400,
Yes.
no, 400 something
80
ang
plus.
recovered?
Yeah.
Ang recovered, Doc?
Yeah.
400? Okay.
100,000 already. Yeah.
That should no longer be in the count. Kasi recovered na eh.
That's right. That's right.
Pangalawa, when they say infected, have we already clarified kung ang infected na yan is second testing, third testing, fourth testing?
Yeah.
Nado-double count ba?
Oo.
Uh,
Maganda nga
well,
yung
individual tests, kasi problema, define infected or case, you define the case as positive PCR. That is a case. Well, that necessarily means infected. Pero that is a case. Kasi we know that RT-PCR measures a viral fragment, the RNA, but it does not necessarily mean it's a live virus. So there's a problem with what defines a case.
Okay, so what is the better figure to use? Kung I don't know if we can convince government or Okta or anyone else to stop using the
I mean, but
400,000.
they are already using that. Yesterday nga, pinagyayabang na nga ni Secretary Duque that the number of patients that are hospitalized is quite low. So he was actually highlighting this, that the cases for COVID has been low now compared to few months ago. So
Sana may nag-follow-up
they
question,
know that.
ano? Eh, kung low na pala eh.
Yeah. Oo nga, yun na nga yun.
Kung low na pala, ano ba? Mahina ang
Ah.
question natin eh. They should have trapped in there. If it's slow, why are we doing this?
Yeah.
Pero
Why are we doing
that
what?
would have been
Iggy?
why are we locking down?
Why is
Why
it locked
are
down?
we
Why are
still-
kids still,
Yeah.
why are the children still not allowed to go to school?
Yeah,
Why are we
Because-
still wearing
So I think-
face shields?
So I think it's a
Oh.
good this is a good time to talk about kids spreading the disease. I think that's a very unfair statement by the government and whoever expert has been saying that the children
Tiga-UP na naman yan.
Precisely. So I think we have to clear this out.
You mean Nolasco?
Doc Iggy, ikaw naman
Oo.
clear niyan. Super spreader daw ang mga children. Really, I feel bad for the
Oo.
kids.
Sino ba yan?
Ano ba?
Ano
Ano ba totoo?
Nolasco? Sino ba yan? Si
I think
Nolasco.
they quoted the pediatric journal.
They
He
quoted
quoted
what?
the
Yeah.
Journal of Pediatrics.
Yun.
And,
Oy,
so I
naku,
double
sino yung
check.
nagsasalita?
I double check the actual article, which they
Okay.
said came from Harvard Gazette. So sabi ko, that's not
Okay.
the way to do it. You don't check the Harvard Gazette and read that and then interpret it from there. Kasi yung Gazette interprets the article eh. If you're a doctor, you read the actual
Okay.
scientific study.
Primary source.
And if you actually read it, nag-extrapolate siya masyado. It made so many mistakes about the data that it's used. It made conclusions about probably the detected cases were not this. Kaya lang, yung study na yun were hospitalized patients. So it does not reflect what it would be in the outside world.
In the real world.
Those are the
In the real
Yeah,
world.
in correct. In the hospital, a child who is sick is certainly contagious. You should wear mask around that patient who is in the hospital. But a child not hospitalized, that is the question. Hindi nila binanggit yun at all. Saying na, of our patients we saw in the hospital who were severe, they had high viral rates, and therefore all children are contagious. Is that logical
Yun ang-
thing to say? It
Hindi
is
nga,
not.
hindi nga. Hindi nga. Para sa ating mga nakikinig, no? Gusto ko lang iliwanag ito, Doc Iggy, ang sinasabi natin, ang sinasabi mo at ang I think the studies that came out is that ni walang sa halimbawa sa Europa o sa Sweden o sa ibang bansa, Switzerland, walang ni isang transmission recorded from child to adult transmission.
Yes.
At walang deaths. Halos zero ang deaths from 19 and below. So, yun nga ang tanong ko how can you be, ano sila? Lahat sila, si Mary, yung super spreader, lahat yung mga bata na hindi namamatay at nagsispread sa mga adults. If that's the case, yung mga bata na lang i-quarantine natin.
Yeah. And remember in Europe, no, in England, in France, no. So even though they had the surge, no, they kept the schools open because it showed that the kids do not spread the disease. So they know that it's actually the kids are infected because of exposure or contact at home, not even at school. So that's one thing that we have to to highlight. I think even I saw this newspaper article, no, Secretary Bjarnes of DepEd said so that kids are get infected at home more than at school. So again, we have to.
So baka ang gawin nila dyan, hindi na pa uwi yung mga bata, Dok.
Doon lang sila sa school. Maganda yan. Parati silang ano yun, di ba? Meron tayo dati nung bata tayo. Matagal na yun.
Boarding school.
Nung bata tayo. Yung di ba sa school?
Wala na ba ngayon? Meron pa naman siguro.
Ewan ko. Meron. Di ba? Meron. Mas masaya nga yun sa mga bata. Ang point is ganito. But puro pananakot nga ang ginagawa. At sobra na ito. Ewan ko lang. Ang nakikita ko lang ginagawa nila yan para to justify the lockdowns. To justify the mask wearing, isa pa yan, topic. O sige, let's jump topic. Are you ready to jump topic? Ito yung nakikita kong topic. Isasabay mo yung maskara, tapos lalagyan mo ng face shield ngayon. Kahit saan ka pumunta, yun ang umiiling na yung isa. Yun ang umiiling na isasabay mo yung face shield. Tama ba yun?
Face shield. I really hate.
Pero Doc, sinabi na kasi ni Secretary Duque na 70+% yata ang reduction or something like that ng pag.
No, they said there was they quoted a paper, a local paper by Herbosa and something. I don't know if you read yung parang they reference that study. It reduces the viral the infection by 99.95.
Wow.
Yeah, so I was asking where is that paper? Yeah, meron. If you go back to
kasi nakadikit. Lalo nakadikit yung
tweet. Yeah. If you go back to the tweets of DOH, nakalagay doon may study, two names. So one of them was Herbosa. I remember it perfectly, but where's the study? Nobody can show us where the study is.
But they saw a study, Doc. Merong study. So we have to trust them na lang kasi sabi nila may study na 99.9%.
We have to trust them na lang. Kailangan makita ng mga doktor yung study. I'm doctor lang. I have to see the study.
Yeah. That's why studies need to be peer-reviewed. May tinatawag na peer review So you have made a study. Peer pa rin kayo. Peer scientist.
Okay, so
sige,
first, yan ang unang challenge. Ilabas naman nila yung study na yon that says 99 almost 100% ang reduction.
Yes.
Right? So let's see the study and let's have it peer reviewed if it has not been peer reviewed. Okay.
Although there are studies already, there are studies.
Yeah, there are studies, but it's not 99.
Na published.
Na nare-reduce ang viral load.
Yeah, it does reduce. But these were for healthcare workers who go house to house, not not the general public.
But if it works, advocate muna ako, if it works for the healthcare workers going from house to house, why will it not work for the common person? Hindi naman natin alam kung sino nasa paligid natin.
I mean, of course, kumbaga, when you use it for healthcare workers, of course, yung level of exposure nila is higher as compared to, the public. So the public, therefore, hindi naman mataas yung exposure. So, yun nga, yung question is, why in the world only the Philippines have to wear face shields?
Well, babalik na naman tayo doon, Doc. Kasi the issue there is, if I go out into the world, I don't know kung ang katabi ko is very, very sick with COVID and tomorrow he's going to be symptomatic. Ngayon, asymptomatic. Pwede asymptomatic siya. Pero bukas baka mag-asymptomatic yan. I will catch it because I was next to him. Yan ang prevailing theory.
But if you're asymptomatic, you're not going to be transmitting the virus.
Hindi
It's
daw
only when
eh.
you
Sabi
start
nila,
having
asymptomatic can
Isa pa
spread
yan.
eh. Sabi ng WHO eh.
Oh, yun.
It's
Isa
not
pa
true,
yan.
diba? So we all know that it's not true. A study showed in Wuhan, diba? Wuhan published a study wherein they tested 9.8 million Chinese, and it showed all of those who were asymptomatic. Okay, they tested
Walang sakit, walang
RT-PCR.
simptomas.
Yes, walang simptomas. They did not infect anyone. In fact, when they tried to culture yung specimen nila, yung nasal swab nila for virus, zero viral load. So walang virus nga even in their secretion.
Okay,
So
Doc, pero Wuhan yun. Malay mo, nagsisinungaling yung mga taga-Wuhan. How can we trust them naman,
Iba-
Doc? Sa kanila nang galing eh.
Anak ng kamote. Anak
Hindi,
ng kamote talaga.
in terms of
Ay, iniwanan na tayo ni Doc.
kinalimutan na tayo ni Doc.
Hindi, babalik yan.
But
Babalik yan.
No, seriously, Doc, that's one argument that they throw at that na how can you believe that study comes from Wuhan? Kayo naman.
Well, there's no point for
Medical
them
study
to lie
published yan,
about
di ba?
It's a peer-reviewed study. It was a peer-reviewed study.
Published.
Baka naman,
So, it's a
taga-Wuhan
published
din yung
trial,
peer-review.
9.8. No, probably not. Probably not.
Tanungin natin si Mr. Oplas. Sir Oplas, kayo ba? Okay kayo sa maskara at saka plastic shield?
Alin tong
Will it increase economic activity?
actually nakikita ko they have a national agenda as well as a global agenda. So I think they're cherry picking data that will fit the narrative. Like for instance, how can you pursue? You include climate crisis, and therefore you must have climate crisis, garbage crisis, and you need many types of legislation and taxation that people should swallow without questioning. And I think that's the more scary the situation that you can make, the more that you can lump in all other unrealistic proposals. Kaya parang katulad nung Manila na kunting kumbot lang, 2,000, 3,000, that's city Manila alone, no? Nahiya silang mag-tax ng taxes, dadaan lang sa mga penalties. So pag kotse mo, bigla ka na tapak doon sa yellow line, 3,000 na kagad yun. Contactless pa, wala ka ng labad doon. So pera-pera na sa kanila yun. Why do they do that? Because sabi nila, marami kang pinaggastusan eh. So all the draconian measures that they cannot impose during the normal times, they can do it now. Kaya mayroon talagang national and global agenda na pinupos. Kaya deliberate sa kanila na gumamit ng mga scary, alarming figures. So ang mangyari sa atin, makikitama yung data natin, hindi tayo papakinggan kasi bad trip sa kanila yun eh.
What's the agenda?
What's the narrative?
What's the agenda?
Oh, yeah, exactly. Maganda yung tanong. Anong
What
agenda raw, Sir
about
Nonoy?
saving lives, diba?
What's the agenda?
Nabasa nyo ba yung the global reset na sinulat ng mga taga World Economic Forum?
Yun,
Ang target nila by 2030, 10 years from now, is practically global socialism. They're saying that people will not own anything and they'll be happy.
Yeah.
Because government, why do you have to own? Because government will provide you with housing, healthcare, education, the house you have to rent, no? So,
But it means also control it. You will have to be under control. So sometimes that might sound good, but you have to give up your freedom. So that's something I'm not at all willing to give.
Same here. Okay, just for our viewers, in case you want to throw in your comments or your questions, please feel free. Just drop us a comment sa ating YouTube page. Okay, go ahead, Francis. Next, are we still on the same, ano? Or
we're still on the same. Pero again, to add to that, no, Mari. So to our viewers, every week we're going to try to have this and talk about things related to COVID, and you can post your comments on the comment section when you see it in Facebook and YouTube. Kami ni Mari, we are banned now. I'm serving the last of my 2 days of 30 days of being banned. Mr. Mari Kaimo has
Ako,
is
90
more of
days,
a
ano?
criminal. Is more of a criminal than me
you're
in Facebook. 60
presently
days.
convicts of FB.
Facebook.
We are convict. Isa pa yan, pwede
Ako,
natin
overnight
pag-usapan.
Overnight lang.
Doktor ka
Wala.
kasi.
Ano ka pa rin? Ex-convict.
Nakaparol ka lang.
Grabe.
Kasi Pasko
Parang
nakaparol ka.
badge, alam mo, parang badge of honor nga yan eh. Yung, to be, so badge of honor. I salute you for being convicts.
Salamat.
Martyrs of truth. Martyrs of truth.
Okay.
Martyrs
Pero
of
linawin lang
truth.
natin sa mga tagapanood natin na baka first time nila mapanood ito. We're not doing this to encourage people to go out and find COVID and get sick with it. Ang kwan lang natin is gusto natin bigyan ng pag-asa ang Pilipino, no? Kasi masyado nang matindi ang pananakot, no? If you pick up the newspaper and to be honest, media makes a lot of money from the fear headlines, no? Kaya nabebenta yung dyaryo kasi nakakatakot yung headline. So
Clickbait nga tawag natin, no? Clickbait.
Mas madali pa nga
Yung friend ko nga, di ba, may na-report sa Congress, 98 congressmen and Congress staff were positive. So it was big news. Tinanong ko yung friend ko na sa Congress pastor, what happened to those 98? I assume none of them were hospitalized, none died, right? Sabi niya, anonymous, pero mukhang ganun nga. See? So it is 98 people, including congressmen, are positive. Big news. Walang hospital, walang namatay. No news.
Hindi na binalita. I think
Hindi
there's a
ba
similar
balita?
news yung
Kasi walang alarm eh. Pag may alarm lang, may balita.
parang yung sa Amazon employees. I think they reported like 100 Amazon employees getting infected without saying that there are 120,000 employees. So parang it seems scary, pero what's 100 to 120,000? So
okay, so habang
1%?
nandun na rin tayo, again, for the viewers who might not have heard this news before, tanong ko na sa mga doktor natin, is COVID a death sentence? Pag nadapuan ka ba ng COVID, sigurado ka ng patay. We just heard it from Sir Nonoy. 98 caught it, pero 90. But go ahead and answer and please tell us what the possible treatment options are.
Ikaw magaling dyan.
Well, actually, as you know, from our data, Philippine data, no, from Philippine data, if you are over 60 and if you're over 60 and over, no, of course your chances of having a severe form of infection would be at least 10% higher, no, compared to those who are not, no, and then of course your chances of dying would be around, if you are hospitalized already, would be around 20 to 30%. So if you are old, if you are sick, if you have what we call comorbidities, of course you need to take some kumbaga panlaban ng mga vitamins and minerals and antibiotics and antivirals, so that hindi ka ma-hospital. So but if you are less than, if you're less than 50, you're healthy, wala ka namang ibang sakit, there's, it's just like a common flu. It's just like influenza, which is what doctors have been saying, especially those yung sa Great Barrington Declaration. They're saying the same thing. Dr. John Ioannidis, the most cited author, in the world, said so. It's just a bad flu season. So, just to say that death sentence is, I think it's really, parang sinasabi mo talagang, patay ka na kasi wala ka ng pag-asa. Which is, sadly, no, ang daming Pilipino, no, talagang when they had COVID, no, natatakot sila. It's either they're thinking of two things. I will die, or what am I going to do now? I cannot feed my family. Dalawa lang. Either I will die, or paano ko napapakainin yung pamilya ko, hindi na ako makapagtrabaho. which is
Oo.
which is really sad. I
Which
really
is
feel
crazy.
bad for
Ah.
for a lot
Okay.
of Filipinos.
Habang nandun tayo, next topic naman, sa Sweden naman. Okay.
Hindi, Mari,
Okay,
may
sige.
follow-up ako ng konti.
Okay, sige,
May
sige.
follow-up ako. Doon sa sinabi ni Doc Homer, ay yung sinasabi niya pag matanda ka na, katulad na hindi tayo matanda, tayo lahat dito.
Yeah. Lahat tayo bata
Ang
dito.
importante, ang importante ganito, at may comorbidities ka, kailangan early treatment kaagad. So which means,
Early.
if
Yes,
you have
early.
influenza-like symptoms, abay kailangan
Yes.
pumunta kaagad kayo sa doktor para matignan ng doktor kung mukhang COVID positive kayo. At kung mukhang COVID positive kayo, even without testing, ay kung pumunta kayo sa doktor na magagaling katulad ni Doc Homer, ay bibigyan kaagad kayo ng reseta. Following the
akala ko resibo.
Hindi, mamaya yun. Tapos ng reseta. Resibo. Bibigyan agad kayo ng reseta. So itong mga resetang ito ay composed of either ivermectin, hydroxychloroquine, zinc, zithromycin kung mukhang positive kayo, and vitamin D, vitamin C, and the like. No?
But Francis, sadly, a lot of I would say a lot. I would say like 98% of the doctors, if you have COVID, di ba? Or if you have COVID-like symptoms, you know what they will give you? They'll give you an antibiotic, not even azithromycin, coamoxiclav, cefuroxime.
Ay, si Dr.
Instead of
Salvania yan. Si Dr.
Tapos bibigyan, instead of vitamin
Pinangalanan
D
ko na
and vitamin C, ay bibigay sa'yo vitamin B, vitamin boy. So we miss the chance of treating
early.
This is this is the analogy. So let's say ikaw nagkaroon ka ng diarrhea. So and they found out you have amoebiasis, di ba? Amoebiasis. So what will the doctors do? Will the doctors say, okay, we won't treat your amoebiasis until such time that you are so sick that you have to go to the hospital?
Yun ang mali.
Or
That's
should we
very
just
sad.
give you an antibiotic and make sure that you don't go to the hospital? It's yun yung analogy eh. So I really feel bad and really feel sad na we could not save more patients going to the hospitals and dying just because of some stupid medical dogmas that it's honestly it's really just wala nang common sense.
Crazy.
I really feel
It's
bad
crazy.
for a lot of people.
Pakiulit nga, Doc, kung ano yung binibigay? What is the...
Doc.
We give
No. Ano yung maling binibigay ng ibang doktor?
maling binibigay, instead of giving like hydroxychloroquine or ivermectin that has been shown to really have an effect on COVID, they give you like cefuroxime or coamoxiclav, which has no activity or no antiviral
Mechanism of
property. So it
action.
does not make sense.
At
Does
bakit
not
nila
make sense.
binibigay yun?
Wala silang may bigay eh.
Takot ibigay yung hydroxychloroquine.
They can, of course, because a lot of them are still under their medical society. So may fear sila that they will be ostracized or reprimanded for what they're doing.
Mari, that's a whole topic eh. Yung they're under the medical community, they're under the Philippine, sino yung, meron ako narinig na sound.
Yung baby yata ni Doc
iba.
Homer.
Ayan. Doc, pakimute. Okay. So in any case, Mari, ibang topic yun eh. Yun yung you're under a medical society, kaya pressured ka. Pag
hindi yata
Doc Homer.
Hindi yata kay Doc Homer galing.
Kay Bienvenido. Yun patay na.
Patay kay Doc Homer na galing. Okay.
So ayan.
Okay ka na, Doc.
Yun, Mari, isang buong topic
Unmute
yun.
ka na, Doc.
Okay, isang buong topic yun, Mari. Yung pag-under ka ng medical community, natatakot kang ma-ostracize. Pag under ka ng hospital, natatakot ka, napagalitan ka ng seniors mo. Or pag nasa DOH ka, natatakot na pagalitan ka ng higher-ups. Hindi ba? Instead of standing for what is right and what the data shows. Kasi 106, ilan na bang studies? Halos 200 na ang studies na ginagawa tungkol sa hydroxychloroquine At
Yes.
even ivermectin now, no? Na humahabol,
Yeah,
parang
ivermectin
nagiging
has over, I think, now it's on 33 studies now on ivermectin. No?
Ilan na ng peer
Oo.
reviewed?
So,
Yeah, peer reviewed is
oo.
around 13 peer reviewed. And,
Oo.
you know,
Ah,
I mean,
and
isikat nga siya sa
oh,
US ngayon kasi nga some of the doctors are saying it's, or even the patients themselves saying it's a wonder drug.
Okay, linawin lang,
oo.
just to be crystal clear, ano? Kung may
Oo.
lumapit sa mga viewer natin sa isang doktor at yan ang binibigay, yung nabanggit niya nga, doc, no? And if that's being given to them, they should decline na lang and look for a doctor who will prescribe something that is more appropriate for COVID-19,
Yeah.
which is
Yes.
you can come to us, no,
Hydroxychloroquine.
sa
Yeah,
Flatten.
hydroxychloroquine or ivermectin, no? So those have been shown to have
Ah,
antiviral properties,
Not
no?
necessarily come to us, but come to a doctor. Go to a doctor who
Mm.
is willing to attack the
Prescribe.
COVID itself, no? With
Yes.
something that
Yeah.
has been known
Yeah.
to work, such as yun na nga, hydroxychloroquine and ivermectin. Okay, Francis.
Yeah.
oo. Yun ang sinasabi ko. So, isang buong topic yan. At I'm sorry for, if Dr. Salvania is listening, I mentioned your name. I'm just ribbing you. Kasi sinabi mo minsan na our doctors at CDC PH have to protect themselves from
Ourselves.
themselves.
Oh,
Di ba?
themselves.
Ourselves. Kaya, medyo tinira-tira mo yung hydroxychloroquine pero tumatawa lang naman kami. So, if you have the studies, Dr. Salvania, that say that hydroxychloroquine does not work, we would like to look at it and let your peers review it. Kasi medyo malakas ang dating mo dun eh. Ngayon, regarding remdesivir,
Sandali lang.
pinupush
Let
ninyo-
his
sir,
peers
okay.
review it. Baka naman yung peers niya anti-hydroxychloroquine din.
Hindi, si
Nakita na
Pierce
natin-
Brosnan. Si Pierce Brosnan yon. Hindi. Hindi. Niloloko lang. niloloko.
Just to reiterate, no, the World
Ah.
Health Organization already said, you know, the remdesivir does not work for hospitalized
Ayun.
patients. So that should be the end
Pero
of it
ginagamit
already.
pa rin nila. Ginagamit pa
What
rin.
can we say? What
Pero
can we
di ba,
say?
Sino
I
yan
don't
din
wanna
ang
say
sinabi ng
anything.
Doc. Yan din ang sinabi ng tungkol sa
Oh.
hydroxychloroquine.
Mm.
The WHO also
Yeah.
said na hindi dapat gamitin ang hydroxychloroquine.
Pero may reason yon.
But
Ano
Kung
yung
bakit
dahilan?
mali yung WHO.
Bakit mali
Ano yung
yung-
reason?
yeah. Well, the dose is too high anyway.
for their
Yung
trials?
binigay ng
Yung nagka-trial
WHO.
sila.
Yeah, the doses
Okay.
were too high. And number two, they were already given to hospitalized, meaning you're already
Advanced.
kumbaga medyo too late ka na. You're already too late kasi puro hospitalized patient eh. So when
Okay,
you give hydroxychloroquine, you should be within 5 days of yung onset, tawag nating onset of symptoms or yung sa pagsimula ng sakit within 5 days, you give it already. No?
Okay, so and what is the treatment kapag, okay, too late na, nalampas ka na sa 5 days, what is the best treatment for that?
Honestly, for if you already in the hospital, no, we would suggest and we would recommend yung protocol
Steroid.
that came out by Doctors Marik and Doctors Corey, no, still uses ivermectin, but of course they also use intravenous vitamin C, thiamine, heparin, and yung steroids or prednisone. So this is kumbaga for hospitalized patients, no? But
Okay.
of course, a lot of hospitals don't use that protocol, but it does work. And they have in protocol by Drs. Marik and Corey really work very well for severe and critical COVID patients.
Okay, so Francis, can we go now to the other topic?
Yes. I was going to suggest that. Klinaro ko lang, Doc.
Good na.
Doc Mari.
Good that you continue that, kasi kailangan na maging malinaw. Doc Iggy, ikaw naman. Gold standard daw ang Sweden kapag dating sa when it comes to handling COVID kasi napakababa na. They never went into lockdown, yes or no? And although mataas yung kanilang death rate at first, that was attributed to their not being more attentive to the elderly na tinatarget ng COVID. Pero ngayon sinasabi nila magla-lockdown daw. Ano ba totoo?
Yeah. Very, very interesting yung nangyayari sa Sweden. Remember that Sweden is the outlier. It is the one that did not follow the lockdown scenario story. So if they become successful, they would make fools of everyone that followed the lockdown scenario. As we know, lockdowns have cost the economies and actually lives of people. So if you fail, and someone who did not use that kind of lockdown and succeeded, that would practically show that you're a bunch of, could be
Fools.
actually, you would have fools, you have caused so much damage to your economy. So ang laki talaga ng issue na yan, that Sweden must fail even in the eyes of people. But if you look at the data, talagang hindi sila nag-fail. That's the problem. So you will see Bloomberg, you will see Yahoo, you will see Business World coming out with articles that would use a fact that is not connected to another information just to show as if it's failing. In U-turn, yeah, sure, nag-U-turn in Stockholm, but not Sweden. Because in Stockholm, there was just a rise in cases. So the mayor wanted help. But if you still look at the data of Sweden, hindi naman pala grabe. So they just use one information. So I've seen that repeatedly over the past 4 weeks. And why in the past 4 weeks? Because in the past 4 weeks, we have seen that the deaths in Sweden is much lower than more than 8 or 7 countries in Europe who have
Yun.
lockdown.
Yun.
And therefore,
Yun ang
they have proven
Oo.
they have proven them to be fools, or proven that lockdowns don't really work. The expensive, the life, the killing lockdowns was actually not a good thing.
And on that point, no, kasi Pilipino tayo, as Pilipino, very emotional tayo. So the minute you say 8,000 nang namatay, ang feeling ng Filipino, dapat walang namatay ni isa dun sa 8,000. So anyone who says you should lift the lockdowns is viewed as a discompassionate. You're not caring, you're not concerned about the poor, yung mga namatayan. Ano ba kayo? What's wrong with you? Bakit gusto ninyong i-lift yung lockdown? Hindi naman ninyo hindi niyo ba alam na 8,000 nang namatay?
Yeah.
Yun, hindi lang yan, Mari.
Hmm.
Mari, Doc Iggy, hindi lang yan. Ang sinasabi nung may isa nagsabi, tinan mo ang Pilipinas, ilan ang namatay? 8,000. Ang Sweden, ilan ang namatay? 7,000 plus. Di ba?
Yeah, ay maliit yung population.
Tapos maliit ang population
Yun,
nila, 10 million lang. Ang Pilipinas, 100 million. So ang lockdown, effective yan. Isipin mo,
Okay.
mas
So-
dense tayo.
so-
So kinumpara nila ang Sweden dito sa Pilipinas.
Yeah.
Tama ba yun, Doc
Wait,
Iggy?
while we're there, let me just add on that to another argument, no? Very very dense ang population as opposed to them na
correct.
kalat-kalat. Okay, so isa pa yun, no?
Kalat-kalat.
Can you address that?
So
We cannot
the
compare
first one-
Sweden to Manila because Manila is so dense.
Yeah, so the first one, that only 8,000 and we don't care about the 8,000 because we want to lift lockdowns. But did you know that lockdowns have killed us, would likely kill up to 130 million people worldwide. And this was predicted in August. Because they thought mawala ni lockdowns. They said, if lockdowns have already cost 130 million, it's already December. May lockdowns pa rin in many other countries. So I would say that's 200 million people dying from lockdowns. The economic cost of lockdowns is that many people dying from hunger. And this is not me inventing this number. This came from the United Nations Food Organization or something. But it's there. I
Pero
just
Doc Iggy,
forgot
may
the exact one.
nagsasabi sa iyo, nagsasabi dito. May nakita ka na bang namatay ng gutom?
Yes.
Oh
yes,
yeah,
meron.
yeah. Oh my God,
Meron.
that was really, that was.
Meron doktor nagsasabi niyan, no?
Yeah. So just because you don't see it, it could only mean you don't go outside or you don't look for it.
Yes, you don't see.
That's what it means. So you're in
Yeah.
an ivory tower or ano. So if you really look for
Si
it.
Doc Ethel Pineda yung nagsabi nun, di ba?
Ay,
Yun lang kwan. Kilala ko yun eh. Oo, doktor. Actually, dati ko siyang friend, kaso lang nagdedebate kami kadating kasi masyado silang hardcore sa kay Duterte. So, ano man yung policy ni Duterte, whether it's drugs killing or lockdown, support sila palagi doon.
Yeah.
So,
I think
the second
one
part.
thing also.
Anyway,
I'll go back
I
to the
think
second part.
one thing we also have to consider yung yun nga, yung excess mortality, yun na hindi na pag-uusapan.
Okay, paki-explain lang para sa audience natin. Excess
Okay,
Kaya
mortality.
sagutin ko muna
Okay,
Mari,
sige.
yung
Sagutin mo
Yeah,
muna.
sagutin
Sweden.
ni Iggy muna. Sagutin ni Doc.
yung sa Sweden about yung comparing Sweden to the Philippines.
Mhm.
That is not a fair comparison because if you look at the data, deaths in European countries, deaths in North America are like 10 times compared to Asian countries.
Mhm.
So syempre, if we compare them to us, talo talaga sila sa atin. Sabihin nila, dahil kasi nag-lockdown kami. Kaya konti numbers natin.
Ayun.
But-
So ang
but-
sinasabi,
But if you compare the Philippines to other Asian
Yun.
countries
Oh.
na hindi nag-lockdown, talo tayo.
Sino yung mga countries na yun?
Japan.
Japan.
Ay sabihin naman ng
Taiwan.
Pilipino, kita niyo naman kung gaano kalinis ang Japan. Lahat naka-gloves, lahat naka-mask lagi.
Yeah. But again, my point being that the comparison
May
is
sagot ako
not
dyan, Mari.
correct.
Ano sagot mo?
Kasi comparing
Hmm.
Sweden to all the European countries, as it turns out, even yung Norway, even Finland, if you just himayin mo lang mabuti, lumalabas pa rin na parang mataas pa rin yung numbers ng Norway, ng Finland. Kung ihimay mo yung their past number of deaths, kung gawin mo yung excess death na pinag-usapan natin mamaya,
Mhm.
mas marami pala excess death ngayon ang Finland compared to Sweden. And I put
Compared
out
to
a graph
Sweden, yeah.
showing yung Sweden's numbers. And they compared it to the past 5 years. Makita mo, in the past 5 years, in the month of November, August, September, October, November, there's no difference from the past 5 years in the number of deaths. So that shows to you, talagang wala na, nakontrol na nila yung virus. Kasi, bakit unlike nung first few months, March, April, May. So it really shows you how effective no lockdowns.
That reminds me
Partly.
of a study that was mentioned dun sa Senate hearing sa US, sa second Senate hearing on early outpatient treatment. Yung Marine recruits na pinag-aralan nila, napaka-stringent ng kanilang lockdown, napaka-stringent isolation, double cloth mask nga lang, hindi N95 ang ginamit. Pero kumalat pa rin si COVID kahit na napaka-stricto na ng kanilang conditions.
They were quarantined. They were tested frequently to trace kung saan galing.
Hand washing, etc.
So apparently, hand washing, all the things that we are doing even half-heartedly here in the Philippines, they did it strictly monitored. I'm sure may CCTV camera pa ron. So apparently, despite everything you do, you will still have an infection. Yun nga mahirap. Unless siguro nagano sila gas mask, astronaut suit, maybe that would have made a difference. Diba? All throughout their how long was that? Was that a 2-month study?
I don't
Something like
remember
that.
that.
Yeah.
Medyo matagal 'yon. Ako ngayon nagtataka nga ako, Mari, yung mga squatter natin, yung mga people who are dikit-dikit sila. Tapos walang mask, walang everything. Nagkahawaan ba? Hindi ba?
Ano bang sagot dyan?
Nagkahawaan, pero walang symptoms.
Yun, okay. Hindi tinablan. Namatay si COVID sa kanila.
Yun ang, alam mo, mahirap tanggapin yung asymptomatic ka, tapos you're a spreader. Hindi ko maintindihan. Si Mary lang yata yung gano'n. Sino ba yun? Sa tuberculosis ba yun? Si Mary. Sino ba yun? Typhoid Mary.
Yeah.
Si Typhoid Mary, alam mo ba? Was she really a super spreader?
Yeah. Well,
Mary was. Bloody Mary, she was a spreader.
Okay, ngayon, ang tanong ko, kung siya ay super spreader, mayroon bang mga super spreaders na asymptomatic na may COVID?
But potentially, it's actually a theoretical thing. It's a general principle in public health or in medicine. The more symptomatic, the more contagious. So that would be a very, very rare case na asymptomatic and yet very contagious. And so I'm not sure Mary, they were...
Yeah.
Si Typhoid Mary, I'm not sure if they were really able to do any testing titers about her. It just so happens that everywhere she goes, nagkakaroon ng typhoid. But they did not actually do any yung mga swab about her. Gano. Kasi nung time na yun, wala pa eh. So that's still a question could she have been really the carrier? But she was, all doctors practically know her. I think trying to poise the issue
You-
of asymptomatic carriers, which is very,
Yun na
very
nga,
rare.
Very rare. Okay.
Yes.
Maliwanag yun, Mari.
Doc
Very
Iggy,
rare. How rare is rare?
Doc Iggy, di ba
Oh.
if we go to by herd immunity, is precisely the point is that people are somehow infected but without symptoms, and in the process, no, the immune system is able to tame or kill the virus. So, to a certain extent, people infecting each other, especially among the health,
It's a
is
good
somehow a
thing.
good thing, right?
Yes,
It will hasten herd immunity.
it is how it is happening practically in all epidemics.
Yeah.
Herd immunity is the natural outcome of all epidemics. And you can reach herd immunity by vaccination, by exposure to other people, whatever. But herd immunity is like, sabi nga ni Bhattacharya, it's like gravity. You cannot deny
Gravity.
it.
Cannot deny it.
Yeah.
Okay, but you can
So the
legislate it out
question
of
is-
existence, apparently.
So the
Ah.
question is, how will you reach herd immunity? Via
Okay.
Lockdown.
Now,
vaccines or via
Vaccine.
natural
maganda
means?
yan ha. I'll tell you a story about yung I just posted something on my
Vaccine.
Facebook page eh. And about 3 days ago, I posted something about a study ni Sunetra Gupta. Sunetra Gupta came out with a very good modeling study based on many countries' COVID epidemic behavior. And she made the conclusion, basically, that if by natural immunity, you only need to reach around 20% of the population to reach herd immunity. By vaccination naman, if you use vaccination, you have to vaccinate about 60% of the population to reach
Wow.
herd immunity.
Oh,
So these are
Laking
very
pera
good
niyan,
Explain.
modelings.
Ang laking pera.
No.
Yeah. So
Laki
Pero
pera.
explain. Bakit,
Pero I
bakit,
think, Doc Iggy, you have to explain kung bakit 20% lang. Paano yung
bakit
40%
20
na
versus...
ano? So yeah,
Kasi-
I think that's the more
Na- na-
important thing, the 40%
yes,
na nawawala.
because natural herd immunity kasi happens because the healthy go out. Kasi sila yung madalas lumalabas talaga. Diba? While the less healthy are staying at home, not exposed to a lot. So, if the healthy are already immune, so what are the chances of you being at home getting it anymore? Kasi na-expose na lahat yung nasa labas eh. So parang you're in a sea of immune people. How can the sick person on the other side of the sea infect you? So kasi sila yung lumalabas. That is how natural herd immunity works. Samantalang kung hindi natural, let's just vaccinate everyone. So, kailangan tamaan mo talaga lahat yung lumalabas. Kung hindi mo natamaan yung mga lumalabas. Sabihin natin, hindi mo na-inject si Pedro, nagtitinda ng tinapay. Hindi mo na-inject eh. Pero siya nagdala ng virus sa bahay niyo. Kaya wala pang herd immunity. Pero kung si Pedro, hayaan mo lang makihalubilo, yung mga nagkihalubilo, nagkakaroon ng immunity. So the chances of you getting it becomes lower. Kaya pwedeng 20% lang.
Teka muna, Doc. Kailangan ko klaruhin yan eh. Yung pag sinabi mo magkakaroon ka ng herd ng immunity, ang ibig sabihin, tinamaan ka ng
Na-
virus.
Pwede kang tinamaan, pwedeng hindi ka nagkasakit pero na-expose ka lang. Basta, kasi may levels din ng immunity. Which is,
So,
And I'll-
meron kang
I'll-
antibodies na na-develop? Ganun ba yun? Madidetect
not
sa'yo?
always. Not always. In fact,
or
there's
asymptomatic
tawag doon yung T-cell immunity. So that is not,
Okay.
you don't produce antibodies, but you have a superficial level of immunity. Meaning, hindi na kailangan mag-produce ng antibodies, kayang-kaya na ng T-cells pa lang eh.
Ayun.
So,
So, that
in
does that
fact,
come naturally? Does that come naturally or inherent sa yun? Or unti-unti mong nakukuha?
It can come naturally. It can also be given by vaccination.
Hindi
Ayun.
siya
And you know
genetic,
what?
ano, Doc? It's not a genetic
Ito
thing.
Oh, it's not
there's a
genetic
study
ba yun,
that just-
Doc?
Pwede ring genetic, but T-cell immunity hindi.
Okay.
But there could be immunity from genetics. But let me talk about this T-cell immunity for a while. Did you know that the 95% success nung this Moderna vaccine was determined based on T-cell immunity? So they used a neutralizing test. So parang, okay, nabigyan ka vaccine. Tignan natin kung meron kang immunity. Ang sinukat nila, T-cell.
Ah.
So that's called the
Hindi
neutralizing
antibodies.
test.
I think you have to clear out
Antibody.
antibodies
Yes.
versus T-cell.
Yes, well, yung antibodies kasi B cells, that might take time to get it. Sometimes you may need the second dose to get the B
Hindi ko
cell.
pa rin naintindihan. Ano
So,
ba yung T-cell na yan? Doc, ano ba yung
Yung
T-cell na
T-cell,
yan?
Parang yan yung unang mga sundalong haharap. Parang sila yung mga first
Okay.
set of soldiers who will fight the virus.
The-
And sometimes,
okay.
talo na nila yung
Lahat tayo meron yan.
virus.
Lahat tayo meron yan.
Lahat tayo yan. Sometimes, talo nila yung virus, hindi na lang kailangan i-report pa. Pero gagawa sila ng parang, okay, ito itsura ng kalaban. Pag bumalik yan, alam na natin itsura. Ganon. So may memory niya ng konti.
Galing.
But hindi na nila kailangan sabihin pa doon sa antibodies. Kailangan pa ba natin gumawa ng mga tangke or
Hindi na.
antibodies?
Ayun.
Mukhang
Lalo na
kaya na eh. So ganon yung behavior.
Ayun.
So in
So,
a
may
sense,
ibang
they're
mas-
saying, they're saying Moderna is 95% successful in making T cells. But they have not proven that it would make B cells.
Ayun.
And I posted it on my Facebook. It's there.
Teka muna.
December 6.
Teka muna,
it came
Doc.
out.
Teka muna, Doc. They are making cells? They are
T-cells.
going to make
They don't-
cells?
They induce T cell formation.
Yun.
Is that good or bad?
That's good. That's good.
That's good. Okay.
But,
Parang
but the
ano,
best
di ba?
is B cells. The
Parang
best
you're
is B
just
cells.
enhancing the body's ability to produce a specific weapon for the immune system.
Kaya nga
What,
hindi sila very accurate when they say it's 95% efficacious.
Ayun.
To a
Which is
certain extent.
Probably right, pero is it going to be definite? Kaya nga si Fauci was a bit parang maingat siya sumagot eh. Can you actually prevent infection? Ang tinanong siya eh. So, hindi niya sinagot yun ng
Sabi niya,
diretso ha.
hindi. Yeah, hindi niya
Oo.
sinagot. He's still waiting for the data, no? I think
Yes.
what's important to discuss or to kumbaga clarify is with regards to what are mRNA vaccines. I think that's the most important thing na hindi alam kasi lahat ng maraming tao is what's an mRNA vaccines? How is it different from all the other vaccines that are in the market?
I will hold you on that thought, Mari. Eto, marami na kasi tayong na-discuss tonight, and I think we are going to do this again every week.
Yeah.
So maybe, do we have time to discuss it more tonight, Mari, or let's hold this for next discussion next week? We will talk about vaccines and other stuff that goes on next week.
Sige.
At yung pag-aaway nila Leachon at ni President Duterte, ano nga ba ang magandang vaccine? Sinovac nga ba? Or Sinovac?
Sinovac.
Sinovac na Sinovac?
Sinovac?
Or Pfizer ba? Ang maganda. Si Tony Leachon is used to work for Pfizer. That's why he's pushing Pfizer. Ngayon, kailangan ba natin ng bakuna or pwede ba tayong mag-early treatment protocol? Since the vaccine doesn't stop the protocol, that doesn't stop you from getting the virus, why not treat na lang early? Di ba? Sabi ni Doc Homer, yun ang words ni Doc Homer. So, are we going to discuss it now or do we do this for next session?
Kung willing ang mga doktor
Next
natin
week
to join
na.
us again next week. Meron ako
Yeah.
tatanong. Very quickly lang, Doc Homer, excess mortality.
Yeah.
Tapusin na natin doon.
Yeah. So when you say excess mortality, this is the number of people dying as compared to the deaths of previous years. Yun ang ibig sabihin ng excess mortality.
If 5,000
Ibig
died
sabihin-
last year,
mas
Tapos
this year ba,
5,500.
merong 7,000 ba, 6,000 ba, or maybe 4,000. So was there excess mortality? As what Dr. Iggy was saying a while ago, Sweden had actually lower mortality. So wala silang excess, nabawasan pa nga yung mortality nila as compared to last year. So yung data natin. So we're still waiting for data. Was there an excess mortality due to the lockdown or not? So we're still waiting for that data, no?
okay. So, Sir Nonoy,
Actually, there's data already from the Philippine Statistics Authority, but only until June. The latest report was October 2, and the relatively more complete is until June. And turns out that from January to June 2020 versus January to June 2019, there are less deaths this year. There are less deaths. Kasi actually hindi pa nila nilabas ng PSA yung deaths by causes.
Breakdown.
Yung total pa lang, wala pa.
Yun ang
Pero
importante, death by causes.
ang very likely ang dahilan doon dahil kumunti yung namatay sa aksidente, sa mga nasaksak, mga nabaril. Kasi di ba palaging may marami kasi na aksidente. Yung mga nakainom tapos nakamotor tapos yung poste hindi umilag kaya tinamaan yung poste. Kasalanan ng poste.
Hindi lang yun. Palagay ko, baka dumami naman ang population next year.
Oo nga.
Actually,
COVID babies.
Kasi pag stay home
nga.
ka, baka maraming
wala kang ginagawa.
mga nickname, si Covey, si
Corona.
si Cory. Pinakalaki kasi gawa ka nung panahon na yun eh. Si Lucky.
SARSy.
Si Lucky for lockdown. Lucky for lockdown.
Si Quarry.
Yung excess mortality pala sa Europe,
Quarantina.
kita ko. Yung excess mortality sa Europe, yung Euromomo.eu, meaning European mortality. May dalawang
Napakaganda sa Euromomo, napakaganda.
Sa simula may excess mortality. Pero for many months nawala. Tapos may umangat ulit very recently. Pero so it is not correct to say that it is it's really cause a lot of excess mortality yung COVID.
Okay, dyan naman tayo.
Okay.
Sabi ni Gerard Cabilo, hello po. Hello, Gerard. Welcome to the show. Sir Nonoy, kasi sabihin nila, okay, coming off of that, that explanation, sabihin nila, okay, mas mababa pala ang mortalities natin. It appears so far na mas mababa mortalities. Di dapat ganito na lang palagi. Lockdown na lang tayong lahat kasi mamibigay naman ang gobyerno ng pera. Di ba?
Mali. Kasi yung estimate nga dito, so yung tingnan natin yung GDP, ang estimate na lumalabas na will have minus 9.5% contraction this year. Ang mangyayari nun, dapat we should grow by 11% next year to be on the level of 2019. Okay? So 2019.
One more time.
2019, ito yung GDP natin.
Okay.
Itong 2020. Para marating natin yung 2019 level, dapat 11% growth tayo next year. Pag mga 10% o 9% lang tayo, nasa tayo sa level ng 2018. Ganun kalalim, ganun kadami ang mga tao na wala ng trabaho, mga talagang naghirap, no? Mga restaurant na nagsara, lahat ng buses, mall
employees,
nagsara.
small businesses.
Dami talaga.
Okay, and next follow-up question. Yung mga nagsarang negosyo, let's say by some miracle magdesisyon sila na buksan ang ekonomiya next month. Na acceptable na ngayon ang mga numbers, mababang cases sa ospital, etc. Buksan nila ang ekonomiya next month. What is going to happen to all the businesses that closed down, that have been closed down for the last 10 months? 9 months.
Yung iba siguro makaka-recover, makapautang siguro, pero hindi pa rin eh. Ang problema kasi dito, yung severe lockdown has no precedent. Okay? Right. 9 months unprecedented, yet ginawa nila. What will prevent them from doing it again next year? Yan ang nakakatakot. That will be kung ginawa nila na walang president, lalo pa na may president.
Wala naman kasi nagreklamo, Sir Nonoy. Nobody, di ba?
Tayo lang nagrereklamo eh. Alam mo, ganito, partner. Pag-usapan natin yan next week. Isa pa nga, marami tayong pag-uusapan. May lumabas kanina na governor ng Red Cross. Sinasabi niyang, yung virus raw ay nag-mutate. Na may variant na ang ibig sabihin, nag-mutate yan na ibang variant. Paano na yung mga bakuna? Nabibili natin.
May doktor na nagsabi niyan 4 months ago. May doktor na nagsabi niya 4 months ago.
Okay.
Sino yung doktor
Anong
yan?
sagot? Anong sagot, Doc?
Yung best. Of course, there's a variant. All viruses actually, all viruses actually evolve gradually. But whether they affect yung infectivity niya, that requires proof. You just cannot just announce na it is a worse virus.
So magulo na ito. At saka yung Mari, mask plus face shield. Tinatakot na nila masyado ang mga tao. mass face shield, I guess to guarantee either may nag-order dyan ng face shield at hindi mabenta kaya
Kailangan i-extend. Kailangan i-extend yung
kailangan
lockdown.
i-extend. Hindi ko nga maintindihan yung scientific logic nito or kung sino nag-utos, bakit inutos, bakit ni-require bigla ng IATF, ano ba ang rason behind that.
Okay.
So marami tayong pag-uusapan.
Pero teka, ito yung sagot dyan. Kasi Pasko,
No.
magki-Christmas ang Pilipino. Hindi naman pwede mag-Christmas ang Pilipino, hindi sama-sama pamilya. So, tataas yung kaso. Di ba yan ang sinasabi na? Kaya sinasabi, papatak ng 500,000 kasi bago matapos yung taon.
Parang
May Christmas
Oxford
na tayo.
study na ginawa yan.
Pero
Oxford
hindi
study
kasi
na
tugma Mari. Hindi tugma.
Oh,
Wear face shields, will that people stop you from meeting each other?
yeah.
So hindi tugma yung proposal to what they want to prevent. So if I were to do something to correct that, I would tell you yes, please plan your Christmas gatherings very well. That's the way to do it. Hindi yung wear face shields now para hindi tayo magkaroon ng maraming cases sa Christmas. What's the connection?
Ah.
Diba?
At saka ito, kung si Doc Homer ang tatanungin mo, ang sasabihin ni Doc Homer sa'yo, di mag-prophylaxis protocol ka na lang.
Yun,
Hindi mo
okay.
kailangan
Yan ang sasabihin ko
mag-face shield
sana.
At saka
Yeah.
hindi ba?
Ako
may
naman,
scientific
ang
basis
gagawin
may
ko,
scientific basis yung sinasabi ni Doc Homer
Yeah. Sa
Diba?
focus protection naman, ang gagawin,
ano gagawin?
magpa-antigen test kayo bago kayo dumalaw sa magulang nyo o sa mga lolo't lolo nyo.
Tama. Tama.
That's
tama
actually a
ka
very,
Antigen test.
not a bad test
Antigen.
to do.
Swab ba yun, Doc?
dyan. Ah.
Yeah, swab din, pero
Swab pa
pwede
rin.
ngang mouth lang
Okay.
Kasi
better.
pwedeng may home kit nga yan. You can actually do
Pero tinatanggap
Accept
ba
na ba,
yun?
Doc?
Does everybody accept the antigen test?
No, it doesn't have to be accepted kasi it's for your use. You test it yourself, you saw it's negative, there's a very, very low chance na positive ka kung nag-negative naman yan. Yeah, sure, may error, but better than wearing a face shield now.
Yeah.
How is wearing
Yeah.
a face shield now going to prevent me from
Yeah.
going there and meet my parents? Hindi. Walang effect yun.
Correct.
May comment si
Correct.
Jenard. Sabi ni
Correct.
Jenard, isisisi sa mga hindi sumusunod kada taas ng cases, magic.
Correct.
Magic.
Correct yan.
Oh, yun. Okay yan, ha? Oh, tama ka dyan, Gerard. Jenard, tama ka dyan.
Friend ko yan.
Friend mo ba yan, sir?
Planted,
So anyway.
planted comment.
Okay, dun tayo sa
Anyway,
what is another solution? Nabanggitan natin. What is the prophylaxis solution to Christmas? Bago tayo mag-gather, mamimigay muna tayo. How long in advance? We have what day is today? December 16 na tayo. So ilang araw na lang, Pasko na. What is the best way to protect our elderly parents, our grandma, our grandpa?
Doc
From
Homer.
Well,
infection.
actually, what we can do, you can give vitamin C 3 grams, vitamin 3 grams, which is 3,000 milligrams, and then vitamin D 2,000 IU. Per day, 2,000 IU to 5,000 IU per day, and then you can give zinc. So marami na ngayon vitamin C with zinc in the market, so it's not gonna be hard for you, And then you
Kakabili
can
ko lang.
Oh, very good. And then you can add in quercetin, Quercetin is yung 500 milligrams, 250 to 500 milligrams. So kung wala silang mahanap na quercetin, you can also use EGCG, which is yung green tea extract. So you can use that, so kung wala or ayaw mo kumain ng hilaw na bawang,
Onion.
sibuyas, which is high onions, which is high in quercetin, you can use green tea, green tea, you can use green tea or yung matcha, high in EGCGs. So these are
ano yun, Doc? EGCG.
EGCG.
Binibili ba yan sa
Meron yan sa health stores. You can buy that also,
Ayun.
Or you can just have your green tea,
Doc, favor lang. Can we ask that you put that down in tapos i-add natin sa comments sa baba?
Comment section.
Yeah. Yeah.
Para
Doc,
Ay,
pwede
bawal
ba
ang
yung
mag-comment
Ivermectin? Doc, pwede
No,
ba
Ayun
yung
na naman comment.
sa YouTube siya lalabas.
Sa YouTube. Okay. Sige, I'll make
okay.
it comment. Yeah. And
Ban
then,
ka rin
for
ba?
those who
Ban ka
are
rin ba, Doc?
sa YouTube,
Ban ka
sa
rin sa
Facebook,
Hindi nga ba?
Ay, grabe.
Nakaparol.
overnight.
So anyway,
Ako,
pwede
may
bang
dadagdag ako ron, may
ivermectin, Doc?
dadagdag ako.
Ano?
Francis, may dadagdag ako.
Ano?
The big elephant that's not being talked about,
Oh.
comorbidities.
Ayun.
Ah.
So tandaan nyo, ang namatay sa most of them, even young, if may comorbid, pwede ka mamatay.
Yeah.
Pero pag matanda, walang comorbid, baka nga mas mataas pa ang chance na mabuhay kaysa sa bata may comorbidity.
May comorbidity.
Yeah.
Yeah, so kahit bata ka, akala mo, bata naman ako eh. No, you better work on fixing that diabetes. You better work on doing everything
Or obese,
correct by
no?
lifestyle
Those who are
changes.
obese, no?
Ayun.
Yes.
Yes,
Kung
yes,
sabihin nila,
yes.
malapit na Pasko, makukorek ba yung obesity ko? Actually, hindi. Hindi. Pero, magugulat kayo you can actually make changes dun sa insulin level, ay sa yung tinatawag na leptin levels. By just going on a low-carb diet.
Prior to.
Just go on a low-carb diet,
okay.
yes. That will
Walang
lower your
kanin.
leptin and insulin levels.
Okay.
Kahit
Walang
obese pa.
kanin.
Yeah,
Ayun.
mag-prepare, ganito, mag-prepare ako sa buffet. Hindi ako kakakain ng isang araw. Parang gano'n.
Fasting.
So if you're going to prepare for Christmas, yes, start to reduce your carbs now. Maybe on Christmas you can eat. I think that would help protect yung severe outcomes of COVID if you get it. Including your grandparents, including your parents kung matanda na sila. Sila din. The other one is if you meet, or maybe that is one specific special case na I will recommend mask wearing. Yun lang, dun lang sa time na yun. Na
Habang
sila sa loob ng
kumakain,
bahay.
Doc, nakamask.
No, siyempre habang nakikita pa lang, di ba? Well, you shorten the time. You shorten the time na na-expose sila. And then, do not eat inside. Try to eat outdoors. That's really the best way. So, this tip alone is far better than wearing face shields. Kung yan ang
better
emphasize
than
nila.
wearing face shields. Agree.
Diba? Why don't they emphasize that? Parang takutin kayo, wear face shields, and don't even meet each other during Christmas.
Yeah,
doesn't
that's
make sense
really
to me.
sad.
Is there,
Pero
let me
that's
just
what-
clarify that. Is there a mandate ba na hindi pwede mag-meet in Christmas? Kasi baka sabihin, nag-ano naman tayo. They were
but
inciting
there's
people.
scary
Sinabi ni,
people kasi.
di ba sinabi ni PNP chief, bawal ang
Pasko?
dinner party tsaka lunch party.
Ayun, paano na? Okay, so hindi pala
Paano
pwede.
na yun?
Bawal pala mag-dinner party this Christmas.
Alam mo nga, Mari, iniisip ko, magkasulatan tayo na wala kami pakialam kung magkahawaan kami, we agree to meeting
May
and
waiver.
eating
Quick
together,
claim.
waiver, mag-sign ng waiver, at tapos mag-party. Pwede ba yun? Total, pamilya naman
Kakasuhan
yun.
pa rin kayo ng gobyerno kasi you violated the restrictions.
Abay, sobra na yan. I mean, that's, ano ka ba? Nasa preso ba kami? Gusto nilang mangyari?
Apparently, hindi na pwede maging kasi magiging spreader ka kung ka. If you meet
Spreader.
for Christmas.
Tayo nga nag-forum nga tayo ng walang mga maskara may nagkasakit ba?
Yeah, but I think
Tuhan
it
ba tayo?
against
Hindi. So, sorry po. Huwag niyo na lang
but it really, it really abuses our civil rights, our
That's
liberties. Yeah.
Isa pa yung topic.
For that, I think we need a lawyer. No? Kailangan na
We need
lawyer.
Mr. Perlas
Tandaan nyo,
to
the
join
elderly,
us.
the elderly have, yeah.
The elderly have,
Sige, Doc.
Doc Iggy?
Nag-chop yata signal.
Doc,
go ahead.
si Doc. Anyways, I think
The
we have...
elderly have
Ayan.
very few years to
Yeah.
live.
Okay.
Tsaka yung loneliness.
Yeah.
Hindi hindi
Yeah, the elderly have very few years to live. So imagine mo, elderly, so much away from them, that's already 20% of their last few years.
Diyan.
So, ang laking bagay yan. So, don't take that for granted na sabihin mo lang na
Huwag kayo mag-meet.
sabihin, i-FaceTime mo na lang o
so
i-Zoom
do
mo na
your
lang si
best to
Lola.
protect the elderly. Yeah, not Yeah, I think those are good options din. I'm not saying naman that those are bad options. But marunong mag-Facebook si Lola, hindi marunong
Paano na?
Pero iba yung personal na nakikita mo, hindi ba, Mari?
Yes, so, iba yung
Iba yung
hug.
personal talaga.
Makapag-hug
Alam mo,
halikan mo, di ba?
I think siguro our last words na siguro tonight, no, Mari?
Sige.
Let's continue this next week. Sinong gusto mag-umpisa? Ako na.
Sige, ikaw.
Sana, alam mo, mga kababayan, at maybe the people of government can also listen to us, at marami kaming suggestions na pinag-aaralan ng aming mga doktor, at kami mismo ang lakas namin mag-research tungkol sa mga bagay-bagay ukol sa COVID. Even Mr. Oplas here does his own does research on the economic impacts and everything, and even on protocols and whatever. There are ways of treating COVID-19, and hindi po natin kailangan itong mga extreme lockdowns na ito, at lahat ng mga pinapayo ng ating mga doktor ay scientific based protocols and suggestions. So hindi kami mga outliers, hindi kami mga quack-quack doctors na meron tayo. Ako lang po si Dr. Quack-Quack Lab. Oo. Kami po hindi po kami takot sa COVID. That's why one of the things that we want to do is to flatten the fears, that the unfounded fears. It's not saying that we be careless, no? Pero we are just flattening the fears and putting COVID in its proper perspective. We can live our lives, continue living our lives happily. We don't need the vaccine. Not everybody needs the vaccine. It should be a choice. And we can have early treatment protocols. Huwag nyo lang kaming siraan na yung early treatment protocols namin hindi umubra. Kasi umuubra po. At yung suggestions ni Doc Iggy next week, maybe he'll present the Great Barrington suggestions, which the World Health Organization also recommends. We may do that next week. Yan ang aking final words.
Okay.
Till next week. Okay.
Thank you, Papi Kiko. Si Sir Nonoy naman next.
Salamat po.
Sir Nonoy, go ahead.
Sige, okay na.
Okay, sige. Doc Iggy or Doc Homer? Who wants to go first?
Yeah, sige ako, the beauty before age. So, hindi, but yeah, Merry Christmas. Alam nyo, nagiging close na ako kay Homer. I think I've never been, I always see him on Facebook. I've seen him more often than most of my best friends. Kasi because of this COVID thing. I've never actually engaged in a battle like this, and it's good to have Homer at your side kasi talaga he's really a very good doctor, so I'm happy to have met him as well. Having said that, Merry Christmas to everyone, and let's have a safe but a rational and calm way of dealing with this pandemic that is not really that deadly.
Okay, Doc Homer.
So I would like to tell everyone we should not be afraid. I think that's the main point in our drive, is to flatten the fear. We should not be afraid. No? Even if we do get infected, no, there is a solution. We have early treatment protocols that will definitely reduce the risk of getting hospitalized or dying by at least 72 to 75%. So we should not fear COVID. We just have to protect ourselves. We have to boost our immune system, and we just live our lives. If we need to do something because we have to survive, so we have to do, so we do it. So we should not be letting this COVID affect us too much to the point as napaparalyze na tayo, hindi na natin alam anong gagawin. So there's a solution. I hope people understand, and they should not be afraid of this problem anymore.
All right. Thank you, Doc Homer, Sir Nonoy Oplas, and Doc Iggy. And salamat din, Papi Kiko. Sa mga tagapanood po namin, we hope to see you again next week. Let's continue to raise the spirits of our Filipino brethren. Let's pick up the hope and let's fight on. Maraming salamat po. Thanks for tuning in. See you next time.
All right.